Most of the patients that I work with tend to be a little bit younger, a little bit kind of like high school, college age. But I do get some former like youth athletes, college athletes that now work a little bit more competitively as an adult or just weekend warriors. So this is one of my patients, 31-year-old male, a former college hockey player. Current activity is competitive / amateur disc golf, weightlifting, and skateboarding. So kind of runs the gamut of multiple things. Past medical history from hockey, multiple concussions, an adductor strain, an AC joint separation, mid-shaft tib fib fracture with an IM rod, high ankle sprain with fib fracture with plate and screw. So had a bunch of like things going on, but the main complaint he came in with was right groin pain during disc golf drives and putting. And if you're not super familiar with disc golf is one where it's like a basket with chains on it, and you're throwing a disc off a tee and you're trying to get it in the basket in the least amount as possible. Really similar to golf. So when they do their drives, there's a lot of rotation involved, a lot of opening and closing of the hips. And when they're doing putting, a couple of the putting techniques that he would use, he would be like facing the basket and driving backwards at an angle, almost like a hockey skate, off the back leg to putt. And then also some groin pain with weightlifting movements. It was mostly like deeper like squatting patterns, deeper lunging patterns, and a little bit with deadlifts. And so those were the main complaints he came with. And it was kind of like this lingering thing that he was like, this started in high school when I was playing hockey, and it just kind of continues, and it continues to this day. So this was a very chronic injury that he came in with. And so that's kind of his history of things. So one of the things that I like to use, I really like using the bracelet when I do hands-on work. So I'll kind of let this just play really briefly here. And I have kind of like my screenshot of the screen on the side of kind of what I was looking at. So I'm using the resistive function to try to target a little bit more of that muscle and tendon. So I have the bracelet on my wrist, but then I also have the plate on his back to try to go right through kind of groin. And he would get it up a little bit into kind of like right into the pubic bone as well. So I wanted to kind of target all of that tissue. So I like to use the bracelet. I like to kind of like hit two birds, one stone, and do a lot of my manual work while I'm directly affecting the tissue. Since this was a little bit more chronic in nature, I feel like I treated it a little bit differently than a more acute or subacute groin strain. So I would spend a little bit of time doing this in the beginning, but then I would move more into some active movement. So for this, and I don't have the kind of screen up to it of the machine, but I would drop the resistance a little, or the intensity a little bit for this. I kept it RET. I changed it to a plate on his leg, and just working a little bit isometrically. So just now working a little bit really low level contractile of that muscle as like my next phase. So just a little bit of soft tissue work, and then I would move into this. So I'm kind of like walking you a little bit through like how I might implement this at the beginning of a treatment session, where I might start with soft tissue and then go into really, really low level contractile movements with a little bit of less intensity. Like Dennis said earlier, it can get really, really hot, especially if you have a lot of muscle. Once you start having that contractile tissue actually work. So that might be the next thing I would move to. After that, working a little bit more through length, I like to add this after, because I find that the soft tissue work and then the isometric contraction helps drop some of the pain levels and really gets that muscle nice and warm. And then I might go into, grab my mouse, like an adductor side rock, where I'm starting to really get a little bit of mobility through that, especially now that pain levels are down a little bit. Still keeping the intensity of the machine a little bit lower, probably around that like 30%, during this. I have, as you can see, the ground's still on his back, and that plate is right at the bottom of the adductor area. So it's going right through that adductor and through the tendon as well, all the way up. Just going through some really like light level mobility work. So again, like some soft tissue manual, some asymmetrics, and then a little bit more mobility. And then the last kind of part that I would add in as the start is a little bit more active. So I might take him through a little bit more active of the same movement we just did, where the muscle actually has to work a little bit harder. And again, I still have that plate in the same place at the bottom and then on his back as well. Still using the resistive setting for this, but just kind of like making that progression through. And in the early stages of our treatment sessions, this was a lot of what it was. This was kind of it. There wasn't much more to it, but now this is a great kind of like warm up. We're getting the tissues really, really primed for a little bit of heavier loading or even more dynamic movements that are a bit more sport specific as we progress through the session as well. So kind of where we started was this, and now this is almost like a really, really great warm up and primer to get everything ready for integration into sport and higher level things. So that's kind of my case and how I like to process through using Winback when I'm treating my patients. If anyone has any questions on that.
So Nicole, Don Fabio, so you always heat them up a little bit first and then you progress into the active care, or maybe a different question. This is through the continuum of care, or this is visit by visit, what you showed us?
This was originally like what we did at our first visit, right? And now this is some part of the continuum of care where I'm like almost like starting with this a little bit and then moving into other things. I almost use this as like a primer for some of these like muscle strains and things like that to help open kind of like those windows of more pain-free, a little more mobility to be able to load a little bit more subsequently in that session. So this would be an example of like, we started with this, we spent about 15 to 20 minutes doing this, and then we went into more activity.
Great job. Anything else, Nicole?
I don't think anything too specific. I love using the pads as I go through the process of like really getting tissue to work in like lengthened and shortened states, especially when people are a little bit more reactive in those states, and being able to let them move a little bit more. So